Coronaviruses are a family of viruses that range from the common cold to MERS coronavirus, which is Middle East Respiratory Syndrome coronavirus, and SARS, Severe Acute Respiratory Syndrome coronavirus. Coronaviruses are circulating in animals, and some of these coronaviruses have the capability of transmitting between animals and humans. We call that a spillover event. So coronaviruses typically cause respiratory symptoms, so we recommend basic hand hygiene, such as washing your hands with soap and water, and respiratory hygiene, such as when you sneeze, sneezing into your elbow. Ways to protect yourself against a potential animal source would be to avoid unnecessary, unprotected contact with live animals, and to make sure that you wash your hands thoroughly after contact with an animal, and also to make sure that your meat is cooked thoroughly before consuming. There are no specific treatments for coronaviruses, but symptoms can be treated.
Coronavirus in the United States, what we know about confirmed and suspected cases. Multiple cases of a novel coronavirus known to cause pneumonia have been found in the United States, and more than 70 others are awaiting test results. We understand many people in the United States are worried about this virus and how it will affect Americans, Dr. Nancy Messonnier, director of the Center for the National Center for Immunization and Respiratory Diseases, told reporters on Monday. Risk depends on exposure. Temporarily named 2019 nCoV, the virus originated in Wuhan, China, but has since spread to at least 12 countries, according to the World Health Organization, WHO. The vast majority of the 2,798 confirmed cases are confined to China, but as of Monday 5 people in America had tested positive for the virus. The Centers for Disease Control and Prevention has developed a diagnostic test for the virus and is working on a plan to make it accessible to individual states. As of Monday, the CDC is the only agency within the United States with the capability of diagnosing the virus, so all samples must be sent there for processing. At this time, a centralized process ensures the most accurate results, according to Messonnier. Our most important priority is making sure that the test is accurate, she said on a press call. Speed is important, but accuracy is probably a priority. Generally, she said, the time between the decision that a patient should be tested and the result is around 1 day, depending on where the person is located and shipping efficiency. Suspected cases. As of Monday, there have been 110 suspected cases of 2019 nCoV in the U.S., involving people in 26 states, according to the CDC. 32 samples have tested negative, and 73 are still waiting for results. Messonnier declined to say which states submitted samples, referring reporters to state health departments. Among the suspected cases is a student from White Mountain School in Bethlehem, New Hampshire. The student returned to the U.S. from China on January 6 and went to Littleton Regional Healthcare on Thursday with mild flu-like symptoms, according to the New Hampshire hospital. Measures were taken to prevent cross-contamination until the CDC confirms test results. On Monday, New York Governor Andrew Cuomo confirmed that the Department of Health was still awaiting test results for 5 individuals. Cases are also suspected in Maryland and San Diego County, California. Symptoms of the new strain of coronavirus include fever, cough and shortness of breath. These symptoms are also characteristic of a number of other respiratory viruses, so the virus presence in an area can be confirmed only by a positive test result.